UCSF confirms that the Bay Area man developed that blood clot in his leg after receiving the Johnson & Johnson shot. Here to talk about the vaccine, UCSF infectious disease specialist, Dr. Monica Gandhi. Dr. Gandhi, thanks so much. Appreciate your time, always. Given the concern many women, of course, have receiving the J&J vaccine, should men now also have this concern about blood clots?
So, the CDC on Friday told us that out of 8 million shots, there were 15 cases of blood clots in women, like you said. And they were most of them were between the ages of 18 and 49. And they placed the risk in women of 7 in 1 million for less than 50 and 1 in 1 million for greater than 50. And they didn't distinguish between men and women. They just put a warning label and said, okay, this can cause clots. So in a way, what happened today, which you're right, a man in his 30s did have a blood clot in his leg and likely have this syndrome called vaccine-induced thrombotic thrombocytopenia. It is still rare, but it looks like it can occur in men as well. And so the warning was not actually gender specific and still stands.
Now, a CBS News poll shows more than 20% of Americans say they won't get the vaccine. They just won't. 18% say maybe. What does that mean for our goal of herd immunity?
I would be more worried about those rates if we weren't watching other countries get into very low cases, even with opening up, at rates that are around 60% in terms of what we need for possibly herd immunity. So a good example, Israel, 62% first dose rate, UK, 51% first dose rate among the total population, and they both have very low cases despite opening up, meaning more mingling, outside masks on, all of that. And so I'm hoping that we won't need to get to these 80s% that we had wondered about before, that we could get to 70, and that would be way sufficient for herd immunity. That's what I'm hoping, even if people are reluctant. And I also hope that we can educate people about some of their concerns and more people will take it.
Reduce the hesitancy, sure. All right, tomorrow the Biden administration expected to relax guidelines for wearing masks outdoors. Is it time to do that, given the number of people who have been vaccinated? And I guess, what are we risking if we do that?
I don't actually think we're risking a lot by doing that. And I think that what we're doing is increasing trust in public health. And I also think we could be motivating people to take vaccines, because the more you see normalcy, that may make people want to get there. So the risk of outdoor transmission was always extremely low. And then with our vaccination rates, we're about 42.5% first dose as of today. And with our cases going down in the United States, the last 14-day average was a negative 16% reduction. I think it is the right time to say vaccinated people don't have to wear masks outside, and unvaccinated people, if you're around crowds, absolutely wear masks outside. And I think people can know the difference.
I think so, too. Let's talk about international travel. The EU is ready to let vaccinated Americans travel there soon on vacation if our vaccination rate gets to that 70% of adults. How risky a move is that, both for them and I guess for citizens who want to go there?
This is what vaccination gets you. It gets you back to that normalcy of life. So it is not, I don't think, very risky for Americans going over there, because you're right, the cases rates, meaning the case-specific test positivity, is higher in Europe than it is here, at least specifically in California. We only have 1,739 cases out of 40 million Californians yesterday. So we're very low. So there may be more cases there, but that's what vaccination does for you. It's really protective, really, really protective. And they will still have masks and distancing required, probably more than we, because they have more cases going on. And then I don't think it's dangerous for Europeans for us to go there because we're vaccinated. So then you've just done exactly what you should do to keep yourself safe, which is getting vaccinated and other people safe.
All right, Dr. Monica Gandhi from UCSF. Thanks so much. Good to see you.